We hope this video will help you improve your skills in reading chest X-rays. In order to find abnormalities in chest X-ray images, you first need to know what a normal image looks like. In this video, let's study the normal images. There are 3 points to understand normal images: the elements of chest X-rays, the division of lung fields, normal structures and borders. These 3. Now, I'll explain each of them. Before that, let's understand the relationship between X-ray penetration in black and white on film. X-rays are emitted from the X-ray tube, pass through the patient's body, and reach the intensifying screen. The part where the X-rays pass through easily receives a lot of light from the X-rays, so it appears bright and white on the intensifying screen. Since the film develops this as a negative, the bright white areas on the intensifying screen will be reversed and appear black. In summary, the black areas on the film indicate that X-rays have passed through easily, while the white areas indicate that they have not passed through much. Keeping in mind the principles of X-rays, let's get started with the first point: explaining the elements of chest X-rays. First is the lungs. The lungs are masses of air, and since they have high X-ray permeability, X-rays pass through them easily. Therefore, they appear black on the film. As a side note, when a white region appears in the black areas, the contrast of black and white becomes clear, making abnormalities easier to detect. Next is the mediastinum. It contains a lot of moisture and tends to absorb X-rays. In other words, X-rays have a harder time reaching the film, so it appears white. As a side note, if a white region overlaps here, it is harder to point out and can be a cause for oversight. Next is soft tissue. Like the mediastinum, it contains a lot of moisture and appears white. If a white region overlaps here, it becomes difficult to point out. Next is pleura. The pleura itself is very thin and does not appear as is. Conversely, if it appears, it becomes a finding that suggests pleural thickening or some kind of lesion. Finally, bone. Bone contains a lot of the metal component calcium. As metal also makes it difficult for X-rays to pass through, it appears white on the film. These are the 5 elements. Continuing on, point number 2, I will explain the divisions of lung fields. In addition to the 5 elements, chest X-rays also have terms that represent locations. They are the lung apex field, upper lung field, middle lung field, and lower lung field. The lung apex field is defined as the area from the lower edge around the clavicular attachment of the sternum to the upper part of the lung apex. Below the sternum, the area up to the front end of the second rib is defined as the upper lung field. The middle lung field is defined as the area from the front end of the second rib to the front end of the fourth rib. The lower lung field is defined as the area below the front end of the fourth rib. Finally, the third point, we will explain about the normal structure and the border. Blue text represents the normal structure. Red text represents the boundary lines. First, we will explain the normal structure. Inside the trachea, it is filled with air, and there is adipose tissue within the mediastinum surrounding it. Air appears dark, whereas adipose tissue appears white. The clavicle, as seen in the photo, can be observed one on each side. When taking an X-ray of the scapula, care is taken to ensure that it does not overlap with the lung field. The scapula should appear white because it is a bone, but it becomes difficult to distinguish it from the surrounding soft tissue. The azygous vein is seen to enlarge when venous pressure increases due to conditions such as heart failure. This is the bifurcation of the trachea. It is the place where the main bronchus, which continues to the right and left lung field following the trachea, branches off. The pulmonary artery branches from the right ventricle to the left and right lungs respectively. The bronchus intermedius generally only exist in the right lung. The pulmonary vein is the blood vessel that returns the blood flow of each lung to the left atrium. The posterior ribs are visible overlapping the heart. The cardiophrenic angle is the angle formed by the diaphragm and the heart. You may also see the inferior vena cava just before it flows into the right atrium. The costophrenic angle is the angle formed by the diaphragm and the ribs. The shadow is formed by the air and contents in the stomach. The lower thoracic vertebrae is visible, overlapping with the soft tissue of the heart and large artery. So far, we have described the normal structure represented by blue text. Next, we will explain the representative boundary lines, represented by the red lines. There are two conditions that form a boundary line on the chest X-ray. The first is that materials with extremely different X-ray transmissivity are adjacent to each other. The second is that the adjacent materials are in contact in the tangential direction. When both of these conditions are met, a boundary line is formed. Let's take a look at each one. The area where the left edge of the left subclavian artery and the upper lung field are in contact is visible as a line. The part where the aortic arch and the left lung are in contact is visible as a line. The part where the trachea and right lung are in contact can be seen as a line. In other words, the wall of the trachea is visible and is usually 1 to 2 millimeters thick. If there is a lesion here, its thickness will increase. The contact area between the left lung and the right lung is visible as a line. It is usually a thin line. The part where the left lung and the right lung meet. It is the boundary line located at the front. The right side of the esophagus. That is, The part where the azygous vein runs and the part where it contacts the lung field forms a line. This is the part where the heart and the lung field come into contact. You can also see the part where the heart and the lung fields meet on the left side. You can see the area where the descending aorta and the left lung field touch as a line. As above, I have explained about the visible normal structures and boundaries. This time, we provided an explanation on the elements of chest X-rays, subdivisions of the lung field, and normal structures and boundaries. We would be pleased if you could understand chest X-rays based on this knowledge.